Welcome back to our third episode of Curious Conversations. Today we have our guest, Dr. Melissa Bustamante. Hey, how are you doing?
I'm doing okay. How are you?
Doing great. So, today we're going to be talking about two different case studies that you published in Curious. One that has to do with vertigo in teenagers, and the other which has to do with vertigo in pregnant women. So, let's go ahead and start by talking about your background. Can you tell us a little bit about that?
Well, that would be great. So I'm Melissa Castillo Bustamante. I'm from Medellin, Colombia, and I'm an otolaryngologist. I made my training in Buenos Aires, Argentina, and then I was a fellow, a research fellow at Massa and Infirmary in Boston, Massachusetts. So I spent 2 years of my life doing research with Dr. Herrón Schneider, who is a PI at Massa Infirmary. And nowadays, so I'm back in my country in Colombia, and I'm an assistant professor at Universidad Pontificia Bolivariana. So many of our articles, four of them published in Cureus, actually, they have been made with some fellows and also med students from our university. So right now, I'm an otolaryngologist, clinician, surgeon, and well, a researcher as well.
Wow, that sounds awesome. So you have so many new experiences under your belt. And speaking of experiences, you mentioned that you had a new surgical case study that you wanted to share with us. So before we get into your research, would you mind sharing that with us?
Well, the thing with the surgical training that I've had, so it was basically focused in some otologic setting and also in some neurotologic setting. But actually, what I'm focused really on is in neurotology, which is the clinic of vertigo and dizziness. And actually, I'm a research coordinator of the dizziness and vertigo centers at Mexico City, also Guadalajara, and also Medellin as well. So we have a group of researchers in Mexico and also in Colombia. So we have been collaborating with this research. But our main focus is what happens with people who is complaining of vertigo, and this is one of our settings, for example, that we've done some specific studies in adolescents and also in females, basically in pregnant. In that study that we published on Curious, that it was also very good in pregnancy. So it was focused because our clinic, one of our clinics here in Medellin, is one of the biggest gyneco obstetrics clinic and also maternal care facility in the city. So we were really complained of what really happens with the pregnant females and what we can do as otolaryngologists, because they are always with the obstetrics and also with the internal medicine people, but not always with the otolaryngologists. So we were really interested in those topics, and that's we really decided to do a review. And well, started publishing Curious, and I do really want you to read it and give us some feedback as well.
Absolutely. Well, I have to say I did read it, and they are both very fascinating articles. Speaking of, you know a lot about vertigo. What sparked your interest in this specific condition?
Well, the thing is that many clinicians and also otolaryngologists don't like vertigo. So vertigo could be like a challenging condition, and sometimes the patients are also challenging to treat. You don't know how to treat them. They are always scared, and I'm very pretty anxious. And sometimes as surgeons, for example, because the otolaryngologists, we also are surgeons and clinicians at the same time. But not all the people want to see the patient and take the exact time to treat the vertigo, to see what happens. So I was really interested since my residency training in Argentina, and I do really enjoyed what happens with the people that is complaining of this. And we have that the vertigo could be from the central nervous system or from the ear. So I was really interested in what was really happening with this population. And I think there are few people, for example, in Latin America, that are focused in this setting. So I decided just to go ahead and move forward. And well, that's the thing. And now we are doing like some specific studies. I hope we can publish again in Curious as well. But now we are focused on what really happens with some people that have postural persistent dizziness, that it's one of the newest conditions that have been released from some specific societies in Europe and in the US. So we will see what happens, but this is a fact that I'm not only alone, and we are with some other colleagues in Mexico and in all Latin America working on this setting, because sometimes it's pretty difficult to treat the patients, but there's not enough professionals that are focused in this area. So we do really need more work, more research, and also more reviews, I guess.
Perfect. Sounds great. So let's talk about your reviews. We can start with the narrative review about adolescents and then move to the one about pregnancy.
Absolutely. So when I was in Boston, so I just met with some colleagues from Latin America, and we were really interested what happens in females' health. Basically, what happens in vertigo and what happens during pregnancy and what happens in menopause. And we discovered when we were doing that first review that it's published in another journal that we don't have enough information about what happens with pregnant. So we decided to go just in. I decided to have some of my medical students of third year and fourth year. And we also included in our group a gynecologist, which is one of my teachers from my former university. So we decided just to go in, and we saw that pregnant may have several symptoms, not only vertigo, they can have unsteadiness and also dizziness. Um, since they start with the pregnancy. So we have like some specific weeks. It is basically between the 15th and the 30th week of pregnancy where we do have more frequency of this vertigo. And also females not only have vertigo, they can also complain of fullness or also of tinnitus. So it's a challenging condition, but what really happens with the pregnancy is that they do with the pregnant females is that they do not realize that this is associated with the ear. So they think that this could be, for example, just a dizziness for because they are tired or because they have fatigue or they have another condition, but they do not relate that this may happen for the ear. So this is like the main findings that we had, that it can happen throughout the pregnancy, and also that in those weeks 15 to 30 we have the most relevant symptoms. And also what really happens is that these pregnant females can also have falls. So this is a really concern of public health. So we have to take care of them. And that's the invitation of our article.
Very nice. So, what about the article about vertigo in teenagers? I know the title also mentions some controversies. Can you talk us through those?
Well, because, vestibular migraine, what really happens is that it's a condition that contains not only vertigo, it contains also headache, usually migraine that may happen in family or in person that is consulting. And we do not have that could be tinnitus in the diagnostic criteria of Barani Society, which is the society that is like the most important society of neurology throughout the world. So, but what really happens in the clinic is that we are looking that the patients are complaining of tinnitus. So we just went into the literature and we found out some data that we included in our article. But what is really happening is that people is increasing reporting tinnitus, and it's a bilateral tinnitus, which is totally different to other conditions such as Meniere's disease, which only has the tinnitus in one ear. So this is a bilateral tinnitus, and also the patients are complaining that they may have this tinnitus before the crisis. So it could be like an indicator. It's not a part of the diagnostic criteria of Meniere's disease, but what really happens is that this is controversial. There are like some clinics that they are saying, okay, we have tinnitus in these patients, but some of them say, okay, that would be maybe that the tinnitus is present not only for the vestibular migraine, because it's an underlying Meniere's disease, because they are always like concomitant. So that was the controversy of our article because we see that this population is increasing, but we do really need further studies for this.
Perfect. So, two quick questions then.
Mhm.
Who is most at risk for teenage vertigo? And are there specific populations of pregnant women who are most at risk for vertigo as well?
Well, on our first question, so who else are in risk for tinnitus? First of all, the people who has a toxicity of, for example, that have been in the intensive care unit or have been in the in-setting pay in the in-setting locations of the hospitals. Also, we do have the people that it's exposed to noise, and we also have that some people that has other conditions, for example, central nervous system conditions as well, epilepsy as well. So these are like some conditions that we have to study and we should focus on. And who other of the patients that are pregnant that are in risk of vertigo? Of course, that those that have been diagnosed with vestibular migraine, benign paroxysmal vertigo, so they do have a more risk, higher risk of complaining of vertigo during pregnancy, and also those that had vertigo during childhood. So that's pretty important.
Excuse me.
Don't
Very.
worry.
So, who or what work do you have planned for the future in vertigo research?
Well, nowadays we are working in one of the biggest surveys in neurology in Latin America. So what we are asking now is to professionals in our area about their troubles, some demographic data, and for example, what do they really need and what do they really see in their clinical practice. So this study is undergoing right now, and we have been collecting like 200 surveys throughout all Latin America. So that's one of our biggest studies that we've been doing on. And we are doing some other studies in postural persistent positional dizziness, which is the condition that I've already mentioned it. And we will see what really happens because we are really focused on what happens in the Latin American population. So that's really interesting. I'm really excited to go ahead with these projects.
Very fascinating. And the last question that we had for you today was, what's your favorite paper that you've written so far?
Like mine or some others.
Your paper that you've written.
Of my papers that I've read, well, it's pretty difficult to to have like one, but I think one of my most fascinating of one of the most fascinating papers that I've ever read is one of the Boston Marathon bombings that it's from my mentor, Herrón. So I did really enjoy what really happens with the auditory setting during an attack, something like that. And that's what are the parts that I want to, that I decided to go to Boston and learn so much about the blast injury with my mentor. So I think it's one of the most inspiring papers that I've ever read. And well, for that, I ended up in Boston studying about what really happens with blast injury as well.
That's amazing. I love how that inspired your trajectory. And to finish off, do you have any advice for up and coming researchers?
Well, first of all, I think that all this research that researchers that have been doing like some research, sometimes it's frustrating, and we just struggle when our papers are rejected for the first time. And sometimes we don't know that sometimes the improvements that editors and also reviewers can give us, they are really helpful. So don't take it as personal, first of all, and just keep going. And just if you trust in the quality of your research, that will be amazing and will be published anyways. So just it will take time, but don't struggle. And for example, in my case, just move forward.
All right. Well, thank you so much for joining us today, Dr. Bustamante. Have a great day.
Thank you so much. You too.